I would argue that hydroxychloroquine should be background therapy in nearly all lupus patients. Yes, there are a few who have allergic skin reactions to it, for example. There are some very rare patients that have a lot of GI toxicity. But the great majority of lupus patients should be on this medication from the time of diagnosis onwards for so many reasons. So, yes, it does help disease activity. In particular, it helps skin and joints, but it has a role as a long-term medication to prevent the long-term complications of lupus. We know, for example, that it can help to prevent organ damage, including renal damage. Has a very beneficial profile for cardiovascular risk factors. So it actually reduces LDL cholesterol. It can reduce the incidence of diabetes. Half of our lupus patients have antiphospholipid antibodies, and hydroxychloroquine reduces the risk of thrombosis. For our patients with renal lupus, it triples the complete remission rate on mycophenolate, and there are several studies that show improvement in survival. And I want to reiterate that hydroxychloroquine is our only medication that has been proven to extend survival. Now, there has been concern about retinopathy and how we should monitor for retinopathy. We have used older guidelines as shown on this slide for some time. It is now recognized that retinopathy is more common after years of use than was recognized earlier. So, for example, in my cohort, after 16 years of use, 9% of my patients have retinopathy. The controversy is whether or not we should be reducing our dosing guidelines, which currently are 6.5 milligrams per kilogram, although we always have to reduce the dose if there's renal insufficiency or hepatic problems, and we also reduce the dose in the elderly. It's not clear whether we should go with 6.5 or 5 milligrams per kilogram. I, in fact, feel that in the future, we will base our dosing on hydroxychloroquine blood levels. In other words, we will personalize it. We do have good rules now on when and how to monitor. Here is an example of the monitoring test that's recommended. It's called the OCT, or the Optical Coherence Tomogram, and it basically gives you a nice cross section of the retina. In the parafoveal region, there should be that nice dip that you see on the top. Now, with hydroxychloroquine retinopathy, the dip is gone, and instead of the dip, you see what looks like a flying saucer in the retina. I've always thought this part is fun, that ophthalmologists have a sense of humor. But of course, it's not good to have the flying saucer sign. Now, how often do we need to check? We should check at baseline. And then the guidelines say to check at 5 years, and after 5 years, we should check yearly. Now, our problem is that it's not always easy to interpret these retina studies. And so, for example, in the OCT, if the patient had lupus nephritis and was on high-dose prednisone, they may have had a retinal problem called central serous retinopathy, or CSR for short. When this is very bad, by the way, the patient loses vision, and we have to reduce the prednisone to regain their vision. But this changes the OCT forever. And so we need the ophthalmologist and the rheumatologist to be very careful before we ascribe all OCT abnormalities to hydroxychloroquine. And there are more sensitive tests than OCT, such as the ERG, but the problem with that one is abnormal in anybody who has a cataract. And of course, some of our patients are getting older, they will have macular degeneration that's going to affect these tests. So the ophthalmologist needs to be an expert in hydroxychloroquine retinopathy. Now, I want you to know that patients do not go blind from hydroxychloroquine. I think as rheumatologists, we need to stop the fear of hydroxychloroquine. This is a medication that's been around since World War II. Nothing has changed. I don't have any blind patients from hydroxychloroquine. So I think we need to follow the guidelines for the amount of monitoring, but let's be very careful and not be so afraid of this medication that our patient begins to fear the only medication that's going to extend her survival.